It is exactly top of the hour. Welcome back to Sunday Live here at Citizen Television. We're down to our interview time.
That's right. Well, healthcare in Kenya is undergoing one of the most radical shifts since independence, and this is due to the introduction of the Social Health Insurance Fund. Well, counties will be expected to be at the forefront of implementing this change, but are they ready? Now, to help us shed light on this is Murang'a Governor Kang'ata, who was awarded by the Council of Governors in 2023 for his innovative approach to healthcare and service delivery.
Absolutely. Governor joins us live in the studio. Governor, karibu sana.
Thank you so much.
Thanks for your time. Real quick, explain to us, what is this service delivery of yours in Murang'a?
One, we have expanded the various physical infrastructure that underpins healthcare. So, for instance, increase the number of dispensaries, health centers, and also built more wards for the level 4s and also level 5. For instance, in Gatanga, there was an abandoned project at a place called Kirwara. We have finished it. Kandara Hospital, we added new wards. Also, we are building a new hospital at a place called Mackenzie. When you go to Murang'a level 5, you also find that there's a new building coming up, Madhiu, at a place called Nyakianga. Apart from that, also, we came up with a partnership with NHIF, where we have insured 40,000 households, translating to about 160,000 individuals, medical cover. So they get all forms of benefits out of that: inpatient, outpatient cover, last expense, where, for instance, if a relative of a person under that scheme dies, they get 100,000 Kenya shillings. Apart from that, we also have the maternal support program, when to incentivize our women to deliver at public hospitals. We refund their fare to our various hospitals, and also things like automation. We have automated hospital services in many of the Murang'a hospitals, so that the patient journey is paperless.
So this is over and above what NHIF would ordinarily give when it comes to Murang'a residents. Do they have to pay a certain contribution for this Kang'ata care program?
No, it's completely free.
Completely free.
Yeah, we started with 20,000 households, but this financial year we doubled that to about 40,000 households. So it is completely free.
So with SHIFT coming into play now, how does this affect rolling out of Kang'ata care, for instance?
They are proposing to abolish what we call enhanced schemes.
Right.
So most likely Kang'ata care as it exists now might go. However, they are saying there will be people who will be expected to contribute monthly Kenya shilling 300. So we might now convert Kang'ata care into some form of support to the poor families who can't afford the 300 shillings per month, which is being proposed by SHIFT.
Governor, one can't help but ask the question, what took this long? Why did it take so long? People have needed cover for so long and they're crying out for health care. What took so long?
Well, I may not be able to respond to that. I would propose maybe other players to do so. Be that as it may, it depends on the priorities of any government. So for us in Murang'a County, we came in on a clear mandate that we want to support healthcare. But healthcare is quite huge. It has several moving parts. We do not purport to say Murang'a healthcare is the best, but definitely we came up with a conscious decision. We want to support our healthcare. So that might include our effort now to automate. It also includes our effort to even hire more health workers, including clinical officers, doctors, and also nurses, and also to implement what we call Facilities Improvement Fund, which is a new thing in our country.
Can Kang'ata care be expanded countrywide?
Again, that is best left to other stakeholders to comment. I do not want to compare Kang'ata care and the current proposed, what I would call reforms of NHIF. But the truth is, if Murang'a County expends about 320 million for Kang'ata care, and through that, 160,000 individuals benefit what we call super cover or enhanced benefit scheme. If you were to, let's say, use 32 billion Kenya shilling, 16 million Kenyans would have Kang'ata care benefits countrywide. National government retains about 150 billion at the national level. So it's an issue of just taking a small portion of that and giving it to the people of Kenya without even adding an extra tax on Kenyans. But let us give the new government an opportunity to see how the new reforms will pan out. Who knows? They might be good. But from where we sit, that idea we did in Murang'a was very cost effective. And quite many families benefit, in particular because they also benefit in things like optical care, things like dental care, which for currently very few schemes afford that to the people under them.
Some might argue this probably was a really nice PR program. It's only ran for, 2 years before now Schiff comes and upends it. What do you say to maybe critics who say many governors come up with fantastic programs, but they don't last?
Ours was ready to last, but of course we are waiting to see the impact of the Schiff. And for us, it's not an issue of competition. As long as you render services to the people, for us, that's positive. Whoever renders that, we are okay with that. Yes.
And when it comes to how this is actually done, the mechanics of Kang'ata care, do they get a card that they present at a health facility? How does it work? And even in partnership with NHIF?
First, we enter into an agreement, an MOU with NHIF. We set out the benefits. Secondly, we announced a day when people should come and register. And basically everyone who turned up in our recruitment centers, which were basically all primary school in Murang'a County, they were admitted into the scheme. Mainly they tend to be the elderly, the people with disabilities, orphans, the vulnerable groups. Then once you get the card, you are entitled to certain benefits. One, outpatient, inpatient cover in public and private hospitals which are NHIF affiliated, inside and also outside Murang'a. So if you are in Nairobi, Kiambu, Murang'a, Wajir, you can still benefit. Secondly, if for dental and optical, you can go to various public hospitals and get that service, which is unique because the normal NHIF card doesn't render that. And finally, last expense, if your loved one passes on, you lodge a claim with the NHIF, you are entitled to 100,000 reimbursement of funeral expenses. Yes.
You talked about the groups that qualify, right?
Yes.
Including the elderly.
Yes.
What about those who are restricted to their homes? They can't leave their homes. They're confined to their homes. What happens to them?
We mobilize provincial administration to come and bring them to us. And therefore, generally, everyone who really deserves in Murang'a to get that support does get it. But, Jeff, from where we sit as a county, the main thing which we think we may have made an effort to help the people of Murang'a is the automation. Because you see, one of the main complaints you find in healthcare services, people saying we don't have medicine, we don't know how many patients came to a certain facility. In Murang'a, we have been able to automate our facilities. So you go to a hospital in Murang'a, you only need to produce your ID. Then from there, everything is digitalized. So if you lose your, what we call that leaflet people carry in a hospital, you'll still be treated. If you go to another hospital, you can carry your records. I don't know whether you have that.
There's some clips here. We're showing them actually.
It is, yes.
We're showing them right now.
Yes, because for me, that has even boosted revenue. Yeah, in Murang'a. Like a good example is Murang'a level 5 hospital. We used to get 80,000 per day before automation. After automation, we now get 400,000 Kenya shillings per day. If you look at Murang'a Hospital, we used to get about 900,000 per month. Now we are getting about 1.6 million per month. That money will help us to buy medicine, will help us to buy non-farm. Of course, we have exchequer delays. For instance, Murang'a, we haven't received our exchequer release in the month of December and January. And despite that, we still have to pay our employees. We still have to buy drugs. Now, what do if you don't get exchequer release? So the revenue in the hospitals at times helps us to mitigate exchequer delays.
Governor, I have to ask you this in terms of how you onboard these beneficiaries. So far, 40,000 you mentioned.
Households.
40,000 households,
so
I beg your pardon.
About 160,000 individual beneficiaries.
Okay. So there's a question here on X, because someone is wondering how this is done. They say beneficiaries, are they selected per polling station for political reasons? And a question as to whether these are grassroots campaigners who are prioritized.
No.
Okay.
First, anyone who came to the recruitment, which was open, advertised in the media, was onboarded. So it didn't matter whether you support us or you don't. So anyone who came got it. Secondly, it has nothing to do with politics because we targeted primary schools. They are the nearest to various villages of Murang'a and therefore closest to the common mwananchi, as opposed to, let's say, any other unit we could have used to give an opportunity for people to onboard into that scheme.
Okay. Quick question, this card, does it cater for lifestyle diseases like cancer, etc.?
Yes, it does, to the extent that NHIF covers that kind of chronic disease. So people needing cancer care, they do. I see them going to even private hospitals that render such kind of services, but only to the extent of they're covered by the National Hospital Insurance Fund.
This, of course, Governor, is not the perfect program. You're trying to remedy a problem within the county, but since you've taken office, what would you say have been challenges in bringing some reforms to the healthcare sector?
Number one is the automation. At times we have downtime. Yeah, there are several instances where at times those systems just go off. Reason being, they are domiciled with the Ministry of Health here in Nairobi. It's a collaboration between Murang'a County and national government. So when their machines go off here in Nairobi, also machines go off in Murang'a. To mitigate that, we are talking to the ministry to have servers at clouds or a better service provider. Secondly, the number of patients in Murang'a, people going to our hospitals, has doubled.
Yeah.
Take like Murang'a Hospital. People used to seek services outpatient per day used to be about 700. Currently, it's 1,500. So to mitigate that, we are trying to employ more nurses, more clinical officers. But then again, our budget is constrained. Murang'a Murang'a uses about 45% of its budget to pay salaries, which is against the law, because the law talks of that 5%. It's only that we cannot send people home. But we are trying to create a balance. That problem is what we call a medical equipment scheme that was done by the former regime. Right. They placed various machines in our hospitals. The new administration thinks they do not want to renew those contracts. Therefore, those suppliers switched off X-rays, MRI, CT scan. Now, Murang'a has been forced now to engage those suppliers directly. We are happy to report that the CT scan and MRI are now functional. We are working to revive the X-rays. But to us, those have been our major challenges.
Governor, back to your card. And back to cancer patients, a lot of questions are coming through now. Some of them asking, if a patient is referred to, let's say, Kang'ata National Hospital, or let's say KU, is the card usable there?
Yes, it is. And not only Kang'ata, even, let's say, KU, Referral Hospital. Even I've seen people going to Texas Cancer Center.
Right.
So it is used across the country.
Yeah.
And abroad?
Like India, for instance?
Yes. When you go to what we call foreign treatment, you are entitled to 500,000 Kenya shilling. Yeah, you are entitled to 500 Kenya shillings, 500,000 Kenya shillings. Yes.
Talk about the community health promoters, because that's now health going to the grassroots level. How effective have they been since their introduction late last year, I believe?
Yes, we give them some kits, and they are doing a good job to render what we call primary health care. We are still waiting national government to honor its commitment to send a stipend, which they promised to do so to them. But so far, they are helping us to do what is called pre-registration of patient into afia.ke. You know, when we automated, we encountered one major problem. People coming to the hospital, queuing to do registration into our system. So we have now dispatched CHPs to go now to Mashinani to pre-register Murang'a people into the system, so that when they come to the hospital, they don't have to queue. And that has been a very positive work they have been doing.
Governor, a question here from Maureen, who says, what's happening at Murang'a Level 5 Hospital? Only 2 doctors were on duty Saturday, which was yesterday. She said, when I took my son, I was there at 9 a.m. I saw a doctor at 5 p.m. Again, Kang'ata Care is working and doing a good job, but what about such scenarios?
Yes, like I've said, we are experiencing some challenges. Our facilities are now very overstretched. Murang'a is seeing 1,500 patients per day, and before we used to have 1,700 per day. So our doctors, our clinical officers are really strained. We are doing our best to revive various health facilities in the rural area to ease up the pressure on Murang'a Hospital. Like today, we were in Madioya, Keru, at a village called Kagongo, to open a clinic there, a dispensary. The other day, we were also at a place called Getiri in Mogoiri, Kiaru constituency, and several other places. That way, if we revive rural health care, maybe the pressure on Murang'a Hospital might reduce, and that problem raised by the person texting.
Maureen,
remedied.
And what about onboarding these personnel? Because there's a question here from Andrew who says, how many medical officers, doctors at entry level has the county employed since you took office?
Yes, we have employed only about 15 doctors. And the reason is, as I have said, our budget, salaries consume 45%, which is against the law. The law talks of 35%. So the window for us to employ more county employees, including doctors, is very constrained. To remedy that, we are doing our best to increase our own source revenue, because once you expand own source revenue, you shrink that percentage and you get a small window to employ more. Otherwise, if things remain the same, we are really straining in terms of having opportunities to employ more county employees.
Yeah. Got a message here, a tweet here from Kijanawa Insurance says, Kang'ata Care is a revolution for our generation. Quality medical care is very essential for Murang'a. Let the other counties follow suit, because a healthy nation is a thriving nation.
Thank you.
All right. We can wind up now. Thank you so much, Governor, for coming in and shedding light on this. Once again, we need to see what the implications will be when SHIF finally comes into play. But one final word before we let you go.
Yes, first is to express my condolences to the people of Kegumo, Kahumbu. I saw you ran a story of people getting disease after consuming some meat inspected by private vets. We will dispatch a team tomorrow to see what we can do to remedy that main problem. Secondly, we are doing our best also to finish various hospitals that we are currently building to ease up the pressure in our main hospitals in Murang'a, particularly Maragua and Murang'a referral hospitals. And also finally, we ask KEMSA to increase what we call fill rate. Murang'a pivoted back to buying medicine from KEMSA, but I hope it can have a better fill rate. It's currently about between 50 and 65. If it could get 100%, then definitely we would not be resorting to getting medicine elsewhere, because as we want to support KEMSA, it is a good institution. It offers very good services. It gives us medicine at a good rate. But now the issue is what we call the fill rate. That is, once you request medicine, what percentage are they available at KEMSA? I think that would help. Finally, we are implementing Facilities Improvement Fund, which is basically allowing hospitals to spend money at source. We have automated the requisition process. That way, hospitals will no longer have to sweep money collected to the county treasury. They will spend that money at source. And therefore, we foresee a possibility of hospitals now being able to buy more drugs, more non-farm at that local level, without the long, laborious procurement process that exists currently. And God willing, once that stabilizes, various problems in healthcare might be remedied.
All right, Governor, we'll keep you posted, and we'll keep tabs on how this is going on as we move forward. This is Murang'a County Governor Irungu Kang'ata with his version of Obamacare, a.k.a. Kang'ata Care. Thank you, Governor. Thanks so much for being a part of the show. Are we done?
That's right, we are done.
Oh, wow. Okay. Should we do this again next week?
I was waiting for you to ask that. We have no choice, Jeff.
Thanks so much, folks. Have a great week.
Good night.
Good night.